We have the best airport in the Caribbean, and through this best airport in the Caribbean, two Delta cases snuck in. When I say we, I'm talking about Trinidad and Tobago. Our Piaco International Airport has been voted the best in the Caribbean. Some exciting news, I guess, for the airport authority and those who are responsible for making sure that the airport functions well. But unfortunately, on top of that, we now see that we have at least two cases of the Delta strain now confirmed in the island. I believe they are quarantined. They were returning nationals, returning unvaccinated nationals. So that in itself is stirring up a bit of animosity, let's say. They already There's already not that much extra impetus needed to get people to get at each other's throat when we're talking about these vaccine issues. And I think the fact that unvaccinated people brought in the Delta strain is not going over well with some people. But there are lots of interesting questions to raise with that. Also, on top of all of that, we over here in Trinidad and Tobago seem to be hitting upon the vaccine lottery. We got options now. Well, not that many options yet. Our options, I believe, are still limited to the AstraZeneca and the Sinopharm shots. The AstraZeneca, we got the remainders that we were supposed to get for quite some time from the COVAX facility, and then we got some gifted from Canada. And I wouldn't doubt those two instances are related, because Canada was one of the holdups for the COVAX facility, because good old Canada, who is gifting people vaccines now, was hoarding them all in the earlies. And however, we have also received or heard some information about some intended giftings of Pfizer vaccines from the US. Now, these Pfizer vaccine gifts from the US, they come with much preparatory statements. We've been hearing about these gifts for quite some time now, and they haven't reached yet. But each time we hear a little bit more and a little bit more. And then on top of that, so we have some Pfizer planned some Pfizer carded from the US as a donation. We got some AstraZeneca from Canada. We got some more AstraZeneca from the COVAX facility. And we also have already planned some Johnson & Johnson shots that we were told about a few months ago being sourced from, I believe it's the African Council. So I can't remember the exact name, but some kind of African Science Council business, African board, and they would be sourcing some of these Johnson & Johnson shots. And we were supposed to get a couple 100,000 of those, and those are the single shots, the Johnson & Johnson shots. So we got options, at least potential options out there. But in these options, there has been some recent developments. With these options that make some of them seem less effective, to put it bluntly. They become less effective, it would seem. And the science there is telling an interesting story, and it may change again how we really are going to have to deal with this pandemic and how we are going to exit this pandemic in the first place. So let's get into these stories. If you haven't clicked that like button yet, please do click that like button and drop a comment. Tell me what you think about the stories of the day. Tell me what you think about the stories of the world, how you think the world is going right now. I know sometimes the news is tempted to always make it seem like everything is doom and gloom, but it isn't all the time. So drop a comment, tell me what you think. If you aren't subscribed, please do click that subscribe button and share the video to those you think may like this kind of content and who you may think may benefit from this style of content. Okay, so Piaco ranked best airport in Caribbean, third best in Central America and region. The Airports Authority of Trinidad and Tobago has announced that the Piaco International Airport has topped the region as the best airport in the Caribbean, as declared by the Skytrax World Airport Awards for 2020 to 2021. Further to this, in relation to the global region, Central America and the Caribbean, the Piaco International Airport has also been ranked by Skytrax as the third best airport, edged out only by Panama's Tocumen International Airport and Costa Rica's San Jose International Airport, respectively. Now, maybe the Piaco Airport, in its beauty and wonder, has waned on me, but I don't want to be the kind of guy that always sounds like you're insulting your own thing. Like, I don't like the sound of that when people always speak negatively about Trinidad. I don't share that view. I'm just kind of surprised that Piaco is so highly held. I didn't know that. I honestly didn't know that. And it's pleasant news to me. But either way, through this number one in the Caribbean airport, now we had 2 Delta cases coming in. TNT confirms 2 Delta cases. COVID-19 Delta variant arrives with 2 infected returning nationals from US and Mexico. Trinidad and Tobago has confirmed its 2 first cases of the COVID-19 Delta variant of concern. In a statement on Wednesday, the Ministry of Health disclosed that the first patient is a recently returned national who traveled to Trinidad from the United States. It added that the second patient is a recently returned national who traveled to Trinidad from Mexico, transiting through Panama and Guyana. Wow, quite a few touch points there. The ministry said, as per existing quarantine protocols, the nationals provided negative PCR tests, which were taken 72 hours prior to arrival. It added that the nationals were immediately placed into state-supervised quarantine as per the protocol for unvaccinated adults. As a result of the positive COVID-19 results from their 7th-day swab, the persons were subsequently transferred and isolated in a state step-down facility. If they're in a state step-down facility, I'd suppose that the symptoms aren't that severe. The presence of these Delta variants were confirmed via gene sequencing at the laboratory of the Faculty of Medical Sciences, University of the West Indies. So, the symptoms don't seem to be that severe. One thing that seems to be holding with the Delta variant, wherever you see it around the world, it does seem to be, whether vaccinated or not, it does seem to be a little less deadly. I do not have confirmed data saying that, but although many places you're seeing a skyrocketing of the infection rates when the Delta strain comes about, you aren't necessarily seeing that reciprocal increase in the level of death. So maybe that's a positive with the Delta strain. But with this Delta strain, these 2 people that came in, I'm wondering, when they came in, first of all, these 2 people came in on separate flights, obviously, because one came from Mexico via Panama and Guyana, and one came from the US, seemingly a direct flight. Were they on those flights by themselves? And okay, you needed a negative test and still go into quarantine if you are unvaccinated. But we so happen to know now, as a matter of fact, that vaccinated people can and do carry the COVID-19 virus, particularly the Delta strain. So all the other people on this flight with these people that brought in the Delta variant, what happened to all of them? Were they all quarantined and kept in a secluded quarantine facility, or were the vaccinated ones, after providing that positive test, allowed to leave? Because if they provided a positive test, well, if they got the Delta strain as a vaccinated person, they would have provided a positive test. Obviously, they would have only gotten it some point in the last few hours they were on the flight. And then they are now free to roam inside Trinidad and Tobago as a vaccinated person, and possibly even as an asymptomatic carrier, because that is a tendency that can happen with vaccinated people. They may not get severe symptoms. That's still a benefit of the vaccine. You do not get severe symptoms. You do not have as high a risk of dying, but you can be a carrier. So I think this Delta strain in the island is even more risky than just the 2 people that have been identified so far. But to our benefit, we have finally started receiving more vaccines. It would seem now that I think for the for the rest of this pandemic, we may have finally reached a point where we have more vaccines than people wanting to take the vaccines. The supply exceeds the demand, and I think that's a crucial thing in the vaccine. And the new emergence of the options in Trinidad and Tobago with these vaccines is seeing an uptick, and I smile at that. Just the human nature of it. We had the AstraZeneca vaccine in Trinidad and Tobago before. That was the first set of vaccines we had. And a lot of people were very apprehensive, and there was a lot of hesitancy for it. Then we had the Sinopharm, and there was the talk about the Sinopharm. And now all of a sudden, when the AstraZeneca comes back, a lot of people are pouring in because the Sino wasn't the good one. The Sinopharm wasn't the good one. The AstraZeneca is the really good one. Now, you want to bet that humans are predictable when it comes to certain traits. We always find a reason and excuse to divide each other. It's going to end up having some talk, some argument about who is vaccinated with which vaccine, and some kind of attempt to place people at different levels because of which vaccine you're vaccinated with. Take my word on that. If it isn't happening already, it's going to start to happen eventually. Well, I have the AstraZeneca. Well, I have the Pfizer. Now, he's a Sino man. He only has the Sinopharm. It's going to happen. It's not just a Trinidadian thing. It's a human nature thing. And just watching how some people are speaking about the AstraZeneca and how this is the real one they were waiting on. And there is a PR battle when it comes to these vaccines. I don't know if any of you pay attention to as much news as I do, but if you're paying attention to a lot of news, you notice it. There is a PR battle clearly when it comes to these vaccines. The Western news media has a lean against the Sinopharm vaccines. And I mean, for obvious reasons. China and the West aren't exactly on the most friendly of terms, so it's not surprising to see that the media in the West don't exactly carry the best news for China. It's kind of expected on that side at least. Which is strange because on another side, when it comes to the entertainment industry, Hollywood and the media on that side is all in support of China, but that's a whole other topic. But we have received that COVAX tranche of the AstraZeneca, and we are in line for receiving some Pfizer vaccines. TMT to receive 300,000 doses of Pfizer COVID-19 vaccine from the US government. Trinidad and Tobago will be one of several Caribbean countries to receive Pfizer COVID-19 vaccines from the US government. The US administration said Wednesday that it will deliver a total of nearly 837,000 Pfizer vaccines to Caribbean nations as the region with limited resources struggles with a spike in COVID-19 cases and reports of several anti-vaccination protests. Well, we were struggling with these spikes in the COVID-19 cases since January, and this news of the necessity of these vaccines in the region was known for quite some time. But I mean, okay, better late than never, I guess. The Bahamas will receive 397,000 doses, followed by Trinidad and Tobago with more than 305 doses. Barbados will receive 70,200 doses, while 35,100 are slated for St. Vincent and the Grenadines, 17,550 for Antigua, and 11,700 for St. Kitts and Nevis. Juan Gonzalez, the National Security Council's senior director to the Western Hemisphere, said the Biden-Harris administration's highest priority in the Americas today is managing and ending the COVID pandemic and contributing to equitable recovery. Thousands of specialized syringes required for the Pfizer vaccine also were donated, with officials noting that the donations involved significant legal and logistic complexity. And I've already started seeing it. I've already started seeing some people who were speaking of hesitancy before. The American vaccine is here. This has to be the good one. It's the one the Americans made. So they're lining up for this. I think that would be some disappointing news because the Prime Minister has already said the Pfizer vaccines are slated to be for school students, and I think specifically secondary school students. 300,000 doses, though, would land us somewhere at 150,000 people that can get a complete inoculation from the Pfizer vaccine. And 150,000, I think, would be well above the secondary school students and well above the amount of secondary school students whose parents, I think, would want them taking this vaccine. Because over in the US, they're already seeing hesitancy, and even greater hesitancy when you're talking about sending this vaccine down for the younger generations. And there may be some new information that would add some interesting bits to this. To some of us who think that the Pfizer is automatically better, there's some new data saying that the efficacy may be waning either over time. The efficacy of the Pfizer vaccine, it's either it's dropping over time or it's dropping significantly with the Delta strain. Now, let's read the article and see exactly what it says. This isn't according to me, this is according to the science, this is according to a study. Out of Axios, new data on coronavirus vaccine effectiveness may be a wake-up call. A new preprint study that raises concerns about the mRNA vaccine's effectiveness against Delta, particularly Pfizer's, has already grabbed the attention of top Biden administration officials. What they're saying, the study found the Pfizer vaccine was only 42% effective against infection in July when the Delta variant was dominant. If that's not a wake-up call, I don't know what is, a senior Biden official told Axios, driving the news. The study conducted by France and the Mayo Clinic compared the effectiveness of the Pfizer and Moderna vaccines in the Mayo Clinic health system over time from January to July. And these were how the results were set up. Overall, it found that the Moderna vaccine was 86% effective against infection over the study period, and Pfizer's was 76%. Moderna's vaccine was 92% effective against hospitalization, and Pfizer's was 85%. Now, there are different things that it can be effective against. This is just talking about hospitalization. As it stands, the Moderna is more effective against hospitalization, at least according to this study. But the vaccine's effectiveness against infection dropped sharply in July when the Delta variant's prevalence in Minnesota had raised to over 70%. Moderna was 76% effective against infection, and Pfizer was only 42% effective. The study found similar results in other states. For example, in Florida, the risk of infection in July for people fully vaccinated with Moderna was about 60% lower than for people fully vaccinated with Pfizer. Why it matters. Although it has yet to be peer-reviewed, the study raises serious questions about both vaccines' long-term effectiveness, particularly Pfizer's. It's unclear whether the results signify a reduction in effectiveness over time, a reduced effectiveness against Delta, or a combination of both. Based on the data that we have so far, it is a combination of both factors, said Venki Soundararajan, a lead author of the study. The Moderna vaccine is likely, very likely, more effective than the Pfizer vaccine in areas where Delta is the dominant strain, and the Pfizer vaccine appears to have a lower durability of effectiveness. Now, this durability of effectiveness, this isn't the first time we're hearing about this, because there were studies coming out from Israel that was giving that suggestion already. Israel was prepping a third booster shot for some of their elderly people because they were seeing that the efficacy of the Pfizer vaccine was waning over time. Out of the New York Times, Israeli data suggests possible waning in effectiveness of Pfizer vaccine. The new numbers still show overwhelmingly strong protection against severe disease, but diminished effectiveness against infection. So they were seeing, as time progressed, more and more people who were fully vaccinated seemed like they had less and less protection from the infection. And this isn't surely scientific. This is conjecture on my part. Do not take this as sound science. But just judging from how things usually go, it seems to make intuitive sense. But intuitive sense doesn't always line up to sense. But it seems to make intuitive sense that if it does wane over time, eventually it wouldn't only just decrease to only lowering the efficacy of reducing infection. It wouldn't just stop at that. I think over time, as the efficacy drops and drops, even the risk of bad illness and the risk of permanent of a permanent end may be increasing if the efficacy of these vaccines are decreasing over time. And what does that say for the vaccinate to operate, or the vaccines being the route out of this pandemic style? What does that say for that? You tell me, what do you think? What do you think is the conclusion we are to draw from this? I hope you enjoyed this, or you were entertained by this, or at least informed, and I will see you tomorrow for the next.
Feel the music, rising with the time.